What is the heart valve disease? The heart valve disease is when one or more of the valves in your heart doesn't work properly. Your heart has four valves that keep blood flowing in the correct direction. In some cases, one or more of the valves don't open or close properly. This can cause the blood flow through your heart to your body to be disrupted.
Heart valve disease has many causes. Congenital heart valve disease is when it occurs before birth and the causes are unknown. There are many causes to acquired heart valve disease. Some of these causes are other heart problems, other conditions, infections, age, and rheumatic fever. Some of these other heart problems are high blood pressure and heart failure, atherosclerosis, which is a buildup of plaque in the arteries, in the aorta, and damage in scar tissue as a result of heart attack and heart injuries. Some of the other conditions are autoimmune disorders, carcinoid syndrome, diet medicines, Marfan syndrome, metabolic disorders, and radiation therapy. Heart valve disease can also be caused by age. Infective endocarditis is an infection that can also cause heart valve disease. It is when common germs enter the bloodstream and get carried to the heart where they can infect the inner surface of the heart, which includes the valves. It is very rare and very serious. It can worsen existing heart valve disease as well. Rheumatic fever is when strep bacteria, which is the cause of strep throat, evolves. It affects the aortic and mitral valves mostly. Symptoms of heart valve disease don't appear till many years after recovery of rheumatic fever. There are no medicines that can cure heart valve disease, but surgery can be used to replace and repair heart valves. This can prevent damage on heart and sudden death or premature death. Surgery also depends on seriousness of the valve disease, your age and health, and if you need heart surgery for other conditions. Ross procedure can also be used to treat heart valve disease. This is when your faulty aortic valve is replaced with your pulmonary valve, and your pulmonary valve is replaced with the pulmonary valve of a deceased donor. Lifestyle changes can be made to treat symptoms and postpone problems. With changes to your lifestyle, doctors may prescribe medicine to lower high blood pressure or high blood cholesterol, prevent irregular heartbeats, and thin blood and prevent clots. A heart-healthy lifestyle includes heart-healthy eating, healthy weight, controlling stress, no smoking, and physical activity.
The heart valve disease is a very dangerous disease for our body. However, we should know the signs and symptoms of this disorder. There is shortness of breath or difficulty catching breath. You may notice this when you are active. Secondly is weakness or dizziness. You may feel weak to carry your normal daily activities. Discomfort in your chest, so you may feel pressure or weight on your chest. The next is palpitation, so you may feel a rapid heart rhythm, irregular heartbeat. The next is rapid weight gain, so you may gain 2 to 3 pounds easily. And a few other are swelling of your ankles, fatigue, headaches, irregular heartbeats. What organs and organ systems are affected? Circulatory system. When your valves become stiff or don't close properly, it strains the heart, causing heart rhythm abnormalities, thus making the heart weaker, causing the heart muscle to become weak, and blood cannot be pumped efficiently enough to get oxygen to all of the cells, which may cause heart failure. The respiratory system is also affected, as the stenotic valve will cause differences in oxygen and carbon dioxide transport, which will cause abnormal gas exchange. Backward blood flow will reduce your heart's ability to pump blood and cause buildup of back pressure in your heart and lungs. Another organ that is affected are the kidneys. Kidneys filter the blood, and not all the blood will be filtered, as the valve opening will become narrow, which limits the amount of blood pumped to the rest of the body. Thus, the waste from the blood will not be filtered, causing a problem in the excretory
There are many things
system.
that you can do to prevent a heart valve disease, such as not smoking, getting regular exercise or staying active, having a healthy diet plan that's lowering cholesterol and saturated fat and trans fat, having a healthy weight, reducing your stress levels by meditating, taking medicines that lower cholesterol levels, prevent a high blood pressure, heart failure, and heart attacks, and also see a doctor. 150,000 Canadians suffer from aortic valve stenosis, which is one of the major types of heart valve diseases. A population-based study has shown that 2.5% of Canadians suffer from heart valve disease every year.